Hey there, my name's Natasha Matar, and today I'm going to talk to you about a common sports injury, tibial stress fractures. So first, let's review what exactly a stress fracture is. On the left, we have a stress fracture in the fibula, in the center, in the metatarsals, and on the right, we have a stress fracture in the ankle joint. Just to give you a couple of examples. So we can define a stress fracture as tiny cracks in a bone as a result of repeated low-magnitude loads or not taking enough rest between training. So now that we know what a stress fracture is, what exactly is a tibial stress fracture? A tibial stress fracture is, quite simply, tiny cracks in the tibia. So typically patients will feel gradual and localized pain, which means tenderness from firmly touching the inner shin bone. So although the injury occurs in the tibia, this doesn't mean neighboring tissues won't take some of the pain too. The tibia and the fibula are like cheese and crackers. They complement each other. The fibula is actually posterior to the tibia. So sometimes if the tibia is injured, the fibula will be affected too, because force is transmitted via the interosseous membrane that connects the two bones. Some other tissues that may be affected will be the soleus muscle, Achilles tendon, and the posterior tibialis muscle. So the cause of the injury is repeated bending of the tibia. The tibia supports the superior parts of the body, and when it experiences impact with the ground, it bends slightly. When the stress on the tibia from running outpaces the body's ability to rebuild the bone, a stress fracture can occur. So activities that may cause tibial stress fractures are excessive weight-bearing activities such as running, sprinting, or jumping. Tibial stress fractures are mainly caused by intrinsic factors versus extrinsic factors. So what I mean by intrinsic is bone structure, bone composition, and biomechanics versus mileage or running surface. So the causes of these intrinsic factors are poor diet and foot abnormalities. So for poor diet, a diet low in vitamin D, or low in calcium, which both support bone function. The complications of tibial stress fractures could be a tibial shaft fracture, which is when there's actually, the tibia is actually broken apart, or a fibula fracture, or actually a rupture in the Achilles tendon. These are all if the patient keeps running or exhibiting force on the tibia. So the recommended physiotherapy exercises. First, we'll focus on flexibility. So some exercises could be moving the ankle dorsiflex and plantar flex with the hands, extending and flexing the knee, flexing the calf and stretching the Achilles tendon in the process, using a wobble board while seated, to move in different directions with feet in slow, controlled movements. And then they'll work on strengthening. So they'll focus on different muscle groups possibly affected by the injury. This will be on a daily basis with slow, controlled movements and 10 repetitions for each exercise. So an example is the soleus muscle. They'll do calf raises. And for the hip abductors and hip external rotators, these are actually really important because they support the tibia and actually the lower limb, and they're important to strengthen because they eliminate the abnormal stresses that are common for stress fractures. Third, they might do hydrotherapy because water reduces the stress of gravity on the leg while at the same time providing resistance that will help build strength. So jumping jacks in shoulder deep water, using a kickboard to propel the patient across the pool, jogging in water that is chest or shoulder deep while using a weighted belt to keep the patient upright. are just some examples. And finally, the prognosis, with all the appropriate rehabilitation exercises and by avoiding running, most patients recover in 8 to 12 weeks. However, patients with more severe stress fractures, it may take 3 to 6 months. And for hastened recovery and optimal outcome, early physiotherapy treatment is vital. So, thanks for listening to my presentation, and I hope you never get a tibial stress fracture.